children
Recording in
over
progress.
the past month. Coupled with staffing shortages due to the pandemic, we are now in a health crisis unlike anything we have faced since the beginning of the pandemic.
At work, who had a
Not
personal
just here in
connection with Shane
Cincinnati,
Bartek,
but across the state.
for the most part,
Whether or not you believe COVID to be a serious health risk to you personally, this crisis impacts you. When hospitals are forced to make impossible decisions in triaging cases, we all suffer. Residents with any health challenges are put at risk. To flatten the curve and help keep our hospitals running as they need to, it is vitally important to get the vaccine, to stay masked, and to get tested. Testing not only keeps you and those around you safe, but it keeps people away from the hospitals and gives them the capacity that they need. Working with cities of Ohio, we are taking action. Mayor Justin Bibb and I, along with mayors across the state, have worked with the state of Ohio to provide assistance, and today we are urging continued and expanded support. I'll now turn it over to Mayor Justin Bibb to expand upon the situation in Cleveland before briefings from Cincinnati health officials. Mayor Bibb.
Thank you, Mayor Pruval. And I just want to share the sense of urgency that we have in Cleveland as the mayor is also seeing in Cincinnati. I took office last week, and tomorrow we are launching our COVID-19 task force. It'll be our first meeting on Wednesday, and it's a collaboration of public health experts, hospital CEOs, elected officials, faith community, and other key stakeholders to really make sure we have a very focused approach right here in Cleveland to address the spread of COVID-19. First and foremost, the biggest thing we can do to stop the spread of COVID-19 is to make sure our residents get vaccinated. Right now in the city of Cleveland, only 45% of our residents are vaccinated, and that's not good enough. So we have to spread the word. We need more urgency around the importance of getting vaccinated and getting boosted to ensure we can decrease transmission rates across the city and across the state of Ohio. Particularly, I want to urge caution and concern for our hardest hit parts of the city, particularly in communities of color in Cleveland. And it's important that we focus our efforts to make sure that our residents feel confident in the vaccine and confident in the importance of the science to ensure we can stop the spread of this pandemic. I also want to make sure that we recognize the important work of many of our grassroots activists on the ground that are addressing a lot of the concerns and hesitancy our residents see day in and day out as it relates to the vaccine and getting a booster shot. So we need to uplift those voices. We need more support from our state leaders to make sure we have more testing available and more masks available as well, because we have all the tools in our toolbox to fix this and stop this pandemic, but we need to make sure that the access to these tools are equitable all across our city and all across our state. With that being said, I'll kick it off to our public health leadership here in Cleveland, Brian Kimball and Dr. Sharon Cooper.
Mr. Kimball, you are muted.
Thank you. Thank you, Mayor Bibb. Cleveland continues to, COVID-19 transmission continues to occur at a historic level. In Cleveland, we've experienced, in our last week, we've had over 5,000 cases. This translates into about 1,354 per 100,000 residents in the city of Cleveland. This current new wave of COVID-19 infections continue to overwhelm our hospital systems. One of the key points that, one of the keys to our success in getting through this surge is really our community outreach. As Mayor Bibb mentioned about the community activists that are really leading and really encouraging people to be vaccinated, that's been a key to our success. This helps improve our communication, educating and informing the public. It helps us to mitigate the impact of this pandemic in our community. So we have to increase that. We want to make sure that Our residents are up to date with their vaccination and booster, wear a 3-layer mask in public, and stay 6 feet away. Try to avoid large community gatherings, and these mitigation factors or variables will help translate into reducing the transmission of this most recent variant. So with that, I'm going to turn it over to Dr. Cooper, who will talk a little bit about some of our past experience and what we've reported in our most recent 18-month report.
Thank you, Director, and thank you, Mayor. Yes, so to emphasize what the Mayor said, we really do have all the tools in our toolbox. What we do need is more access to testing so that we can determine where the virus is, who's infectious, how to mitigate the spread even more. We collaborate with a lot of partners within the area, and one of our key partners is Case Western Reserve University, the faculty from that university. And with them, we have begun to analyze the data that has come in, and we're able to create an 18-month document, which is showing the process as it evolves, because it has been changing. It's been changing very rapidly, and we have evolved with the situation and have been trying to make sure that we control as much as possible every measure that we have. So that includes, as the director mentioned before, our community outreach efforts, testing of wastewater, making sure that the community has masks, making sure that when we have test kits that we're able to share them among our partners. So, with those efforts, we are really hoping to continue to take control of the virus in some form or shape so that, we can have a healthier Cleveland.
Thank you. And from Cincinnati, from Cincinnati's Health Department, Dominic Hobson.
Thank you, Mayor Purell. I really want to speak to the level of spread that we've seen here in the city of Cincinnati and in our region here in Southwest Ohio. For the last 2 days, we've seen a record-breaking number of new admissions for COVID-19 patients at 109 and 125. That's more than we've seen throughout this entire pandemic. We've also seen a significant increase in impact on our children, which Mayor Purell spoke to. A lot of times we think of this virus as a virus that impacts our adults, but there has been that 500% increase when we look back just 4 weeks ago, looking at the amount of admissions for our kids from 0 to 17. And we know that these numbers are not sustainable for our hospital systems. Here in the last 2 weeks, we've seen multiple reports from hospital systems that they are evaluating delaying non-emergency and elective procedures. And we saw the impact that this had on our community 2 years ago or a year ago when we have to delay those important procedures. So we all have to chip in and do this together. Our hospital systems can't do this alone. I also want to speak to just the timeline to give you a perspective of how quickly things increased in our region. On December 26th, we'd had 159 new COVID cases in the city of Cincinnati. Less than a week later, there was a 983 new cases. That's a 500% increase in 1 week. Just how fast things have increased in our region. Of course, we saw our first Omicron case on December the 12th, and things have increased rapidly since then. So we're working with city leadership, putting using every tool that we have to try to address this virus. We're continuing to offer vaccines at least 5 days a week, encouraging everyone to get vaccinated and boosted. And of course, now our kids are able to get boosted. We have also expanded testing effective yesterday. We have testing sites across the city 5 days a week, and we're encouraging everyone to go to our websites and take advantage of what we're testing. We know that there has been a pent-up demand on testing in our region for a period now, and we're hoping to address some of that pent-up demand by expanding access to those critical testing resources. And similar to what everybody else has said here, we have to use every tool that we have continue to encouraging everyone to get vaccinated and boosted. We have to continue to wear our mask, and we have to social distance from others when we're in public. We have a long way to go to manage and get through this pandemic, but we believe that we know how to do this. We've seen this curve increase and decrease over the last 2 years. But if we use the tools that we know we have, we'll be able to address this and improve things in our regional areas.
Thank you, Dominic. As you've just heard, this is a crisis. To protect our hospital services, we need folks to get vaccinated, to get boosted, and to wear a mask. This moment in time also drives home the urgent need for more resources from our state leaders. One that includes more staff, masks, PPE, and most importantly, testing for our cities. The cities of Ohio will continue to work together, pushing for more support, more resources, so that testing sites have the tests and the staff they need to get residents back to work as soon as possible and to keep them away from the hospitals when possible. With that, we'll take your questions. If you could use the hand raise function on Zoom, I will call on folks. I'll try and keep it equitable between Cleveland and Cincinnati Press. The first hand I see is from Dan DeRuz. Go ahead, Dan.
Thanks for holding this joint news conference. It's much appreciated to have access. This first question, or my question, is directed at new Mayor Bibb. Mr. Bibb, can you explain your reaction? I'm assuming at some point in your first week, you looked over what had been in place from the previous administration as far as their plan to fight COVID. What was your reaction to their plan? Was it insufficient? You pointed out only 45% of the city is vaccinated. And is that the reason for launching tomorrow your task force?
Listen, this is a time right now to look towards the future, not the past. The biggest thing that alarmed me in terms of what we should be doing as a city is more on the ground conversations, talking to our residents, particularly in communities of color, about the importance of the vaccine and also about the importance of getting boosted. And I think for far too long as a city, we weren't really honest about the lack of trust that these communities have in this vaccine and a lack of faith and trust they have in the science. And we can look at history to talk about why that lack of trust exists. And as mayor, it's my responsibility to take the leadership role in assuaging their concerns and using every tool in our toolbox inside City Hall, but also outside City Hall to address those concerns for our residents.
And just to follow up, it would go a long way to know your vaccination status. Are you vaccinated? Are you boosted?
Yes, I'm triple vaccinated and boosted. So, and when another one comes out, I'll be in the front line if I can.
Yeah, and just to reiterate, I'm also vaccinated and boosted as well. Our next question is from Dan, or I'm sorry, we just had Dan. Next question is from James Pilcher, please.
Good afternoon, mayors. Thank you for doing this. Quick statistical clarification from Mr. Hobson. You said the last 2 days, 109 and 125 hospitalizations. Is that just in the city of Cincinnati? And then I do have a broader question.
No, that is our 14 county region that we look at the number of cases across the hospitals in our region.
Okay, so that's all of Southwest Ohio. Thank you. That's what I needed to know. Mayor Purval, you said you're asking for more resources from the state, more specifically, most importantly, testing. I know you opened up more testing this week. UC is opening a new testing facility with the National Guard. How much more testing can you do or should be done? And what are you specifically asking for from the state? And then a follow-up question on that is there any concern with at-home tests that these numbers might be actually lower than what we're actually seeing with people actually testing positive at home and then not going out and reporting it? Is there any concern about that we're underreporting some of these numbers?
Yeah, I'll let Dominic from the Cincinnati Health Department answer your last question about at-home tests. What we're here saying is, number one, that this is a statewide crisis, that we are responding as best as we can, but that we need more help from the state. I'm grateful that the state has testing sites, at Coney Island and at UC Health. But it's just not enough. As you've seen, as our local news has reported, our testing sites have been overwhelmed by the amount of demand, and having testing adequate to the need is so critically important for two reasons. Number one, it makes sure that people are safe and they get back to work more quickly, which is critically important, not just to the city and our basic services, but our economy writ large. And it also takes capacity and puts it in the hospitals and diverts that testing away from our emergency rooms, which is really clogging up a lot of our hospital capacity. And so we need more support. We're grateful for the support that the state has provided, but I'll give you some numbers. We announced last week and started just yesterday 5 additional locations for testing, specifically in Black and brown neighborhoods. I agree with Mayor Bibb. We've got to make sure and prioritize racial equity in our response, and we're doing that with our testing locations. But we're struggling to get enough tests to make sure that we can fulfill the commitment we've made to have the testing available to our citizens commensurate with the demand. So I'll let Dominic answer the question about at-home tests.
So of course, that's a risk that we're aware of and that we're concerned about. We're continuing to educate the public on how to use the at-home test, on the importance of reporting your status to the local health district. But more importantly, we've taken a step further. We've started to provide some additional information, some educational cards along with the at-home test, with information for the public on what to do if you have a positive result. We know that there is a possibility that we aren't getting all of those cases reported, but that's a risk that we're aware of in public health. We know that there's others that may have symptoms who quarantine, who never go to get tested. So, we think we have a pretty good idea of the amount of spread in our community, but we are encouraging all testing capability that we have. Of course, we love our PCR and in-person testing, but the at-home tests are a resource that we must use because that gives us more capacity to identify the positive cases in our region and start to encourage those individuals to quarantine to lower the spread in our cities.
Next question is from Jay Williams.
Mine is really a comment. I like to thank so much to our new mayor, Mayor Justin Bibb, for leading the charge in this because this is real serious. And to have Dr. Cooper, Mr. Kimball, all a part of it. Sir, I just want to say thank you because you probably, don't get that enough, but thank you because we need that. And the audience that's listening to us right now are calling in and they are saying thank you. That's what I want to share.
You, Jay, we appreciate you.
Cincinnati Press. Wow, that was nice, Jay. Just kidding, guys. Becca Costello, go ahead.
Good afternoon. Mayor Pureble, you talked about the testing announced last week, those additional staffing sites. But as you know, since the initial announcement, those have actually been scaled back. Is that because of a lack of resources from the state or resources that were promised that didn't come through? And kind of a follow-up to that, we were told at that initial press conference that these 5 sites, or at that time it was actually 6, would be expanded even more. Is that a likelihood or a possibility without this additional help from the state that you're requesting?
Thank you, Becca. It's entirely dependent on whether we can get access to tests. Our procurement department was able to get 30,000 additional tests in addition to the 3,500 tests that we got from the state. But given the demand, we're doing everything we possibly can to get our hands on more testing, but it's a challenge. And so that's why we're here today thanking the state for the Ohio National Guard and the sites that are available right now, but also asking the state for more help getting our hands on testing so that we can use our resources to get it out to the community.
And a quick follow-up to that, what is that communication with state officials like, other than this public press conference asking state officials, are state officials denying the requests that you've been putting through so far?
Our health department has been working consistently with the state and their counterparts at the state. And so we've been in regular communication via our health department, and they're very aware of the challenges we have in Cincinnati and the need that we have. Okay, our next question is from Nick Castell. I'm sorry if I'm mispronouncing your name, Nick.
Mayor, you got it. Thank you very much.
Right.
Question for Mayor Bibb here.
Yep.
Cleveland schools are offering, I believe, voluntary surveillance testing on a weekly basis. What would you like? What kind of testing would you like to see in the schools? Do you want more than that? And I'm interested, kind of more broadly, in your thoughts on, whether in-person or virtual instruction is the best way to go forward right now.
Well, I would rely on my counsel from our public health experts, but all the data that I've read shows that more continuous testing to show you have a negative test, the better you are to show up to school, to show up to work, to stop the spread of COVID-19. In terms of my preference for remote or in-person learning, I think it's very clear. Having our children in school is critical. The recent data has shown that the learning loss, but also the trauma that our children have experienced over the last year of not being in school has had tremendous negative consequences in our respective communities across the country. And so the more we can do to make sure that schools are safe, that our teachers are safe, that our transit riders are safe to get our children to school is critical. And so I applaud the work that Eric Gordon has been doing to support that. We've been in close communication, even in the transition, about the safety of CMSD, and we will continue to be good partners as we try to mitigate the spread of COVID-19 across the city.
Next question goes to John London.
Yeah, Mayor, thank you. I would add my voice to the appreciation for both of you mayors and for the health leaders to be available and to do this. It's very important as we try to get information out.
Mm-hmm.
Mayor Purival, as you know, Saturday, the bars at the banks and all through the city will be packed, maybe for 10 hours or more for the Bengals playoff game. I talked to some bar owners yesterday. They chuckled when I asked about social distancing and masks, because they say even if we were going to try to implement it, there is no way that we're going to be able to do it. They'll be indoors, a lot of hooday shouting. I'm interested in hearing from you about any concerns and thoughts and recommendations that you might have, given the high transmission and the crisis that you talk about.
Yeah, well, it's first off, incredibly proud of our Bengals and our Bengals Nation for making it to the playoffs. I'll be rooting them on as well this week. What's critically important is that people understand that if you are vaccinated, if you are boosted, if you are wearing a mask, then you are as protected as you can be. And again, I would refer you back to the statistics that we started with, John. Over 90% of those who are hospitalized and of those who are dying from this pandemic are those who are unvaccinated. And unfortunately, if you are unvaccinated, if you are not boosted, you are at greater risk. And so I believe that if you're wearing a mask, if you're boosted, if you're vaccinated, then you are safe. And if you're not, then you're not, and you're contributing to the challenges that our hospitals are facing.
So I hear, just quickly, I hear both health leaders from Cincinnati and Cleveland stress masking and social distancing. And I wonder how that squares, Mayor, with, Saturday being indoors and the bars being packed.
Yeah, well, I think the best advice that we can provide from our public health officials is to mask and to social distance when possible. But the biggest thing, and our health officials I know will support this, the biggest thing that we can do is get vaccinated and get boosted in order to protect yourself, because the people who are hospitalized and dying from this vaccine are unfortunately those who are unvaccinated. Question from Brooks Sutherland.
It's for Mayor Purival and Dominic, if you will. We're seeing a lot of breakthrough cases with this latest surge. And while that's happening, there's still a very large gap of people who aren't boosted in the region. What part of your messaging, Mayor, is is the booster going to be implemented? And I mean, will we see any reclassification of what fully vaccinated is? Will there be any requirements of the booster? Can you talk about what you have planned regarding the booster for administration?
Yeah, so we are advocating as strongly as possible to get fully vaxxed, to get the 2-shot, and then to get the boost. In addition to that, my message is specifically to our children. I think in the region, about in the mid 70% of our adults are vaccinated, but our children are lagging behind quite significantly. Only as of last week, 26% of our eligible children are vaccinated, and the hospitalizations over the last month for our kids are really going through the roof. So special message to parents at home to please get your children vaccinated. Boosting is now available for some age groups of children, so please follow through on that. Dominic, would you like to add anything?
Mayor Purval, you touched on those key things. Of course, we are really encouraging everyone to get vaccinated and boosted, like you mentioned, especially our kids now that they're eligible. We are continuing to offer vaccines Monday through Friday. We offer both Pfizer, Moderna, and J&J for those who receive those other doses. So we have plenty of capacity to offer vaccines, and we're encouraging everyone to get the vaccine and get boosted.
Okay, that was another one for Cincinnati. So I'm going to try and get a Cleveland person, Emma Henderson.
Hi, yes, I actually have a similar question for Mayor Bibb that you have already answered, Mayor. I'm curious what the exact ask is from the Cleveland community. You know, we've had the National Guard here. We have large testing sites. Is it more testing sites spread out? And, you know, what type of education are we looking for? And really, how can the organizations that are already here pick up on what you're hoping for? It seems like it's something that they've already been trying to do for a while.
Well, I'd say a couple things. One, we certainly need additional capacity in Cleveland, particularly in communities of color, for the capacity of testing, first and foremost. I'd say secondly, I don't know what the latest recommendation will be yet from the CDC, but more N95 masks are critical because we know that helps to stop the spread of COVID-19. And then it's critical that we double down on the messaging on the importance of getting vaccinated and boosted. That's critical because 45% in the city of Cleveland is not good enough. And part of the responsibility of our task force will be to really examine what other additional public engagement strategies we can do as a city to increase our local vaccination rate.
Thank you. Final question from Michael Indriolo.
Hello. Yes, this is going to be a question for Mayor Bibb and for the Cleveland Department of Health officials. So I've been analyzing data on vaccination rates in zip codes throughout Cuyahoga County. Some of the least vaccinated areas in the county are in communities of color in Cleveland, as you have mentioned, Mayor Bibb, while the most vaccinated areas are in mostly white suburbs. I was wondering if you could share any insights into why this vaccine disparity exists here and what specific actions you and the COVID-19 task force plan to take to address it.
Well, I'll take this first, and then Dr. Cooper and Brian, if you guys could share some insight. Look, in communities of color, there's been a history of medical racism, and we all know the history behind that. And there's been a lot of misinformation in the media and in the press about the importance of the vaccine and whether or not the vaccine is the right thing to do. And as mayor, my administration, we want to tackle that head on. And so we will be looking at some additional public engagement strategies to really address that lack of trust that exists in our hardest hit parts of the city, whether it be knocking on doors, working with clergy and other key community stakeholders. But we need to make sure that in neighborhoods where there's a lack of trust, that we work with folks that are trusted on the ground and talk about the importance of getting vaccinated and getting the booster shot. Dr. Cooper and Brian, anything you want to add to that?
I would say that sometimes access is an issue. However, we have really been working diligently to make sure that everyone has access. We have 2 standing clinics, one on the east side, one on the west side. It's open 5 days a week. We do homebound service. We have community events at least twice per month. We've been doing this since the beginning of the pandemic, and we continue to do it. as it is evolving, we also try to make sure that we are tapping into those areas where more people of color are, and just making sure that in spite of perhaps their hesitancy from the history, as the mayor said, that there's access for when they change their minds and, when they want to come in. Hopefully they'll want to come in and get vaccinated. Another part of this is testing, and the National Guard has been deployed to help us with that. The testing sites would be really important for people to be able to know, what their status is and how we can slow the infection and the spread. As far as I know, the National Guard is deployed at the Cleveland Clinic, the Walker Center, and in Akron for Summa Health, and Columbus in the Ohio State University Werner Center. But pending is testing sites in many different areas with the National Guard deployed, where there can be walk-ins and not just appointments that are made. And so it'll be more accessible to larger communities and hopefully communities of color. And some of those pending sites are Canton, Zanesville, Mansfield, Chillicothe, Toledo, Springfield, Cincinnati, and Dayton. So we are hoping with all the efforts that we put together that we can really, really help to make sure everyone is vaccinated, everyone is masked, everyone is protected as much as we possibly can.
Biggest takeaway, we got to meet people where they are when it comes to this pandemic. Okay.
Thank you all so much for your interest, for covering, for helping us get the word out. Thank you, Mayor Bibb and your colleagues in Cleveland, and have a great day. Bye-bye.
See you soon.